Sentarse. Good afternoon, welcome. Jackie. Mucha energía. Good afternoon. Welcome, colleagues. Buenas tardes, estimados delegados, invitados especiales. Invitados especiales, buenos días, buenas tardes. Es un gusto estar con ustedes el día de hoy en esta sesión. Los invitamos a que se ubiquen, se acomoden, se sienten cómodamente para iniciar nuestra sesión. Mi nombre es Marta Saboya, yo soy la asesora principal de la iniciativa de la OPS para la eliminación de enfermedades transmisibles en la región de las Américas al 2030 y es un honor para mí ser la maestra de ceremonia de esta importante sesión informativa. Les doy la más cordial bienvenida a esta sesión titulada Acelerando la eliminación de enfermedades al llegar a poblaciones en situación de vulnerabilidad, mejores inversiones para la acción, que es organizada en el marco de la iniciativa de eliminación. Tenemos servicios de interpretación simultánea en 4 idiomas. Para quienes están en esta sala, les pedimos por favor que presionen el botón de floor, piso, y allí podrán seleccionar el idioma de su preferencia. Para dar inicio a esta importante sesión, me complace invitar al doctor Jarbas Barbosa, director de la Organización Panamericana de la Salud, quien nos dirigirá sus palabras de apertura. Doctor Barbosa, bienvenido.
Muchas gracias, Marta. Buenas tardes. Esteemed Secretary General of the Organization of American States, Ambassador Albert Randi, distinguished Ambassador to the OAS, Minister of Health, delegates of non-state actors and partners, PAHO staff, and participants following us through the live broadcast. It's a great pleasure to welcome you to this briefing session on accelerating disease elimination by reaching populations in vulnerable conditions, best buys for action. Organized with the framework of PAHO's Elimination Initiative. I want to express my deepest gratitude to the Honorable Minister of Health of Guyana, Dr. Frank Anthony, the Honorable Minister of Health of Paraguay, Dr. Maria Teresa Baran, and Mr. Stephen Vreden, advisor from the Minister of Health of Suriname, but I also want to recognize the Honorable Dr. André Misiekeba, Minister of Health of Suriname, who join us today to share their valuable experiences. I think that this will be very important because sometimes we have a PowerPoint presentation and some people, when they are looking, they say, okay, but maybe this is not applicable to my country, or I don't know if this is too ambitious. So the proposal of this technical briefing was inviting countries that are already implementing the elimination initiative. So to share the experiences, what were the challenges, how they overcome the challenges. So I really want to thank you for sharing with us these valuable experiences. I also warmly thank Dr. Robert Matiru, Director of Program at UNITAID. UNITAID is a very important partner for PAHO in the disease elimination, so it's very important to have you with us, Robert. Thank you. The region of the Americas is advancing steadily towards the elimination of communicable diseases. Many countries are adopting integrated approach that expand the access to prevention, diagnosis, and treatment, and are contributing to the ambitious goal of the Elimination Initiative and improving the lives of millions of people across our region. Our success depends on ensuring that the most impactful, evidence-based, and cost-effective interventions reach the communities who need them most. This entails working to strengthen primary health care, reinforce health information and surveillance systems, and secure strong governance of health at all levels. Ahora voy a continuar en español. En esta sesión tendremos la oportunidad de conocer de los países de la región cómo están aplicando en sus realidades locales las mejores inversiones, intervenciones basadas en evidencia y soluciones tecnológicas que aceleran la eliminación de múltiples enfermedades. El gran reto que enfrentamos es superar las barreras para que esas soluciones lleguen de manera oportuna a las poblaciones más afetadas por las enfermedades transmisibles. Para lograrlo, es necesario fortalecer acciones para aumentar y sostener altas coberturas de vacunación, ampliar el acceso a diagnósticos y tratamientos involucrando a las comunidades, fortalecer a vigilância e levar serviços de saúde integrados a comunidades marginadas, privadas de liberdade e assentamentos precários. Estou convencido de que as experiências que se apresentarão hoje inspirarão a países e sócios a adotá-las, escalá-las e sostenerlas, avançando firmemente hacia a eliminação. Há um ano, celebramos a eliminação da filariase linfática como problema de saúde pública em Brasília. Hoje, nos llena de orgulho anunciar outro hito em saúde pública, a eliminação da malária em Suriname. É o primeiro país amazônico em alcançar esse logro histórico. Esse avanço melhora a saúde e a qualidade de vida de los cidadãos de Suriname e constitui um exemplo inspirador para toda a região das Américas. Por favor, unam-se a mim para felicitar a Suriname por esse grande logro. Graças a todas e todos por unir-se a nós outros hoje. Les desejo uma sessão muito produtiva e agradeço profundamente que sejam aliados da Organização Pan-Americana de la Salud e nesse caminho hacia a eliminação de enfermidades na região das Américas. Muitas graças.
Thank you very much, Dr. Barbosa, for the welcoming remarks. It is a true honor to have Dr. Robert Matiru, Director of Program Division of UNITAID, with us today. UNITAID is providing critical support to countries in the region of the Americas and to PAHO to accelerate the elimination of HIV, mother-to-child transmission of 4 diseases, and cervical cancer. We would like to recognize and thank UNITAID for this strong collaboration and partnership. I am now inviting Dr. Robert Matiru to deliver his remarks.
Thank you very much. Honorable ministers, ambassadors, and country representatives, Dr. Yarbas, and PAHO colleagues and friends, as well as other esteemed partners and collaborators in the room. Thank you for inviting UNITAID to make some opening and framing remarks on this really important technical briefing. I'm representing here our Executive Director, Dr. Philippe Dunton, who couldn't join us, but I'm most grateful that I was able to be here to share this session with you. We at UNITAID, who have partnered with PAHO and PAHO's member states for many years, are most impressed by the Best Buy initiative for disease and condition elimination in this region. And we're impressed because of, one, its ambition. It's an ambitious initiative covering 30 or more Best Buys. We're impressed by its focus and clarity. It's very specific about the diseases and conditions. It's very specific about the goals and targets. And thirdly, we're impressed by the timeliness, the attempt to address and eliminate not only in the long term, but in the near to medium term, because every day, month, and year that counts in that timeline is lives that can be transformed, deaths averted, morbidity reduced. From UNITAID's perspective, I want to highlight 3 key areas, although our collaboration and work spans many of these Best Buys, both in infectious and non-infectious conditions. And the first one is to do with EMTCT, or elimination of vertical transmission. I don't need to remind all of us, but if we talk just about children, every year 5 million are dying before their 5th birthday. And the major driver we know, among others, if we talk about infectious conditions, is HIV, syphilis, Hep B, Chagas, to name just a few. But the one common denominator for all these conditions is that they are all preventable with timely diagnosis and treatment. And that should encourage us. But what we should address is the discouraging fact that not enough is being done. And we know that it affects beyond children, pregnant women, and other vulnerable groups. And that's why elimination efforts in this constellation of conditions, among others, is really, really important. And we're pleased to say that in May this year, we launched a comprehensive program called Safe Start Plus. It's a 4-year initiative fully aligned with the Best Buy initiative of PAHO, and almost $30 million in catalytic investment. And the aim here is to scale up uninterrupted family-centered and integrated EVT services. We're focusing on 9 key countries, including Brazil and Paraguay, and also an additional 10 peer learning and influencer countries, including, for example, El Salvador. And why is it a Best Buy? I mean, PAHO has classified rightly Best Buys as cost effectiveness and impact in a timely way. We're focusing on 3 things. Community leadership, because communities are at the forefront of the response. They are the people living with and affected by the conditions who are best placed to support interventions to position these things for scale. But also it focuses on market shaping as well, and generating evidence on the most feasible and impactful ways to deliver interventions. For example, we're going to be rolling out triplex testing that can test in one go HIV, syphilis, and HBV hepatitis B through point of care and new point of care, as well as more established lab platforms. Why is that important? Well, I don't need to tell you, because it's all about translating the talk about integration into reality and leveraging health product innovations as one critical tool towards that integration. Beyond EVT or EMTCT, one really important area is in the area of women's health. And Unitaid is pleased to have been at the forefront of efforts globally since the last 6 years on the second pillar of cervical cancer elimination. We have been the lead multilateral investor in bringing better screening and preventive treatment to women presenting with precancerous lesions. And the innovations that we've supported to introduce around screening, both molecular testing, as well as more traditional testing, as well as treatment, have dropped prices between 40 to 60%. And we've been working with a strategic fund and PAHO member states to translate those prices so that they're available to member states also in this region. Beyond that, the financing is absolutely key, and we're pleased that to date we've invested more than $80 million and are positioned to invest another 50 in the coming 2 years to continue this fight across screening and treatment. We're also looking at novel ways to screen, although they're still exploratory, such as AI and AI-assisted screening. They could be transformational in doing this even more cost-effectively. Lastly, honorable ministers and guests, I want to highlight another critical area. We all know that HIV/AIDS as a major condition has been with us for decades. Up until recently, we had made amazing progress, 40% reduction in AIDS-related deaths, 60% reduction in associated infections. But we know all this is at risk now, given the major defunding that we've seen, and the setbacks could be really astounding. UNAIDS has estimated that we could see an additional 4 million deaths and 6 million AIDS-related infections if we don't address these setbacks to programs. So we were very pleased last week at the UN General Assembly, and this was some of the more positive news coming out of New York, to have announced with President Clinton a massive reduction in the price for lenacapavir as a critical new tool in HIV prevention. 2 injections, almost equivalent to a vaccine per year, giving full protection to vulnerable populations. And that price will be $40 with a generic company in India for the 2 injections per year. And we're aiming with that company to bring that product to market in 2 years, by 2027. And the Gates Foundation, alongside us, announced a similar deal will be upcoming with Hetero in India as well. This will build on other efforts Unitaid is leading on implementation studies. And by that, I don't mean long-term research. I mean practical studies to work with populations on how to assess the feasibility, and the impact and the acceptability of this new technology. So it won't help us eliminate HIV tomorrow, but it will certainly set us on a pathway to really bend the needle, but also, we hope, address the setbacks we've seen to HIV/AIDS programs because of the challenging development financing context we find ourselves in. So I'll conclude there, ladies and gentlemen, and thank you for the opportunity to share some of these concrete examples which are more positive in these negative times on the direction of travel that we can all take together. Thank you.
Thank you very much, Dr. Maturu. We now move to a historic moment, the celebration of the elimination of malaria in Suriname, the first Amazonian country to reach this important goal. To open this part of the program, let us first watch a short video highlighting Suriname's path to malaria elimination. It seems that we have technical issues. Okay, we can wait for the video, and now I'm seeing the video there. Okay, there you go.
Our success has been through governments and the dedication and commitment of our health workers and our policymakers.
Everywhere where there is a community, you can train people from the community in doing diagnosis and treatment and report to you.
Próprio esforço do grupo, nós temos pessoas aqui dentro da malária que realmente estão dispostas a fazer o trabalho com motivação e carinho. Trabalhar com a própria comunidade foi a chave para chegar onde chegamos.
I would like really to congratulate these health workers in this area because I experienced the challenge they are facing to reach these places. You can't do that if you are not committed.
I think in the foreseeable future, we can envision a malaria-free Amazon.
We can change the life of many people by reaching this elimination goal.
To reflect on this important achievement, I have the honor to invite Dr. Sylvain Aldiguieri, Director of the Communicable Diseases Prevention, Control and Elimination Department at the Pan American Health Organization, to deliver his remarks.
Thank you, Dr. Saboya. Honorable Minister of Health of Suriname, Excellency Ambassador of Suriname to the Organization of American States, distinguished delegate from the Malaria Task Force in Suriname, Excellency Secretary General of the Organization of the American States, PAO Director Dr. Barbosa, distinguished delegates, colleagues and friends, I'm really honored to give the introductory remarks in celebration of Suriname being declared free of malaria. Suriname, as our director said, is the first country of the Amazon basin to have successfully eliminated malaria. This is a very important milestone in the history of the fight against malaria in the Americas. Suriname's achievement demonstrates that it is possible to eliminate this disease within the difficult context and ecosystems of the Amazon region, where the affected populations are dispersed, including Amerindian communities, and in the case of Suriname, the Maroon population, and where gold mining has been the main driver of malaria for decades. Around the year 2000, Suriname reported approximately 15,000 cases of malaria per year. During these years, it was the country in the Americas with the highest number of cases relative to its population. Suriname eliminated malaria when it decided to focus its efforts on making diagnostics and treatment available to communities through community health workers and volunteer networks, especially in rural and sylvatic areas. Suriname has now successfully covered the last mile toward malaria elimination, leading the way for the other countries of the Guyanese Shield. Suriname experience is an example of smart decisions, technical knowledge, pragmatism, innovation, and policy continuity. We must recognize the sustained efforts of the Ministry of Health, beginning with Minister Celsius Waterberg, and the actions of experts such as Dr. Stephen Vreden, present here today, and Dr. Martelise Hersel, who we have seen in the video, who for years have served on the task force that was created specifically to eliminate malaria. We must also acknowledge the work of the medical mission, the Bureau of Public Health, BOG, and all community health workers who have dedicated decades of work under the challenging conditions of the hinterland. Congratulations to the people of Suriname. Thank you.
Thank you, Dr. Algieri. Now we are going to recognize Suriname, and it's my honor to invite Dr. Jarbas Barbosa, Director of PAHO, to get together on the stage with Honorable Secretary General of the Organization of American States, Mr. Albert Ramden, and Honorable Dr. Andre Misiakaba, Minister of Health, Welfare and Labor of Suriname, to receive the certificate. Please join us on the stage.
Probably you need to have an extra luggage. Going back home, but it's really a very important one. I think that this will be in a very good place at the Ministry of Health, because it will remind all of us that it's possible to eliminate malaria as you are proving this in your country. Here you have a letter to the President of the country, a letter from WHO, and a letter from PAHO. Director, and you can open that. Show it to us. There we go. Thank you. 1, 2, 3. Second. 1, 2, 3. Thank you.
Thank you very much. Now, it is my honor to give the floor to the Honorable Dr. Andre Misiakaba, Minister of Health, Welfare and Labor of Suriname, for his remarks.
Thank you. All protocol observed. On behalf of the government of Suriname, I wish to express our appreciation to PAHO and WHO for formally acknowledging the elimination of malaria from our territory. This milestone is not only important for Suriname, but also for the Amazon region. While observing the downward trends in malaria transmission, hopes are that in the near future, malaria elimination will be reached across the continent. Supported by several international partners, among which PAHO, WHO, USAID, we have been working for decades on the control of malaria in Suriname. In the year 2002, Suriname had the highest annual parasite index for P. falciparum on the continent. I myself contracted malaria in this period. I almost died. We believe that expanding access to diagnosis and treatment, together with bed net distribution and community involvement, have been crucial in achieving control and eventually elimination of malaria. In the year 2018, due to the steady decline of malaria cases in the country, we became convinced that malaria elimination was feasible. In that same year, a malaria elimination task force was installed with a specific task to guide activities towards elimination. Post-elimination, we do realize, however, that especially with our open natural borders and intense migration, mainly fueled by small-scale gold mining, our status of malaria elimination is still very vulnerable. I will repeat this. Post-elimination, we do realize, however, that especially with our open natural borders and intense migration, mainly fueled by small-scale gold mining, our status of malaria elimination is still very vulnerable. Only when transnational efforts to eliminate malaria from the Amazon region are coordinated, the achievement of Suriname can be sustained. We therefore applaud PAHO's initiative to continuously support the efforts in the region. The Ministry of Health, Welfare and Labor is also aware of PAHO's initiative for the elimination of diseases. This is considered as a powerful action which is welcomed and fully supported by the government and the Ministry of Health, Welfare and Labor in Suriname. Let us celebrate Suriname's achievement today, but also persist in working on improvement of malaria control and ultimately elimination from the whole Amazon region. The government of Suriname herewith expresses its commitment to permanently support these transnational efforts. I thank you very much.
Thank you, Dr. Misiakawa. Ahora nos vamos a mover a la siguiente parte de esta importante sesión. Vamos a presentarles las mejores inversiones o los best buy, como los han mencionado en inglés, han sido bastante mencionados en esta sesión. Así que tengo el gusto de compartir con ustedes de qué se trata esto de los best buy, que los han estado viendo en la exposición que tenemos al frente de la sala durante esta semana. Vamos a ver si pone... Ok. Entonces, este año, la Organización Panamericana de la Salud lanzó lo que estamos llamando las mejores inversiones para la eliminación de enfermedades. Y las lanzamos por la razón que está reflejada en esta lámina. La región de las Américas ha sido exitosa en la eliminación de enfermedades. Tenemos 51 países y estados miembros. En verde oscuro, ustedes pueden ver el número de países que han eliminado algunas enfermedades, principalmente aquellas prevenibles por vacunación, la transmisión urbana de la fiebre amarilla por Aedes aegypti, entre otras. Sin embargo, ustedes ven que hay unas barras verde más clarito. Esas son enfermedades y el número de países que están muy cerca de alcanzar la meta de eliminación. Hepatitis B de transmisión madre a hijo, el doctor Matiro la mencionó. Tenemos las herramientas para lograrlo. Rabia humana transmitida por perros, más de 35 países llevan años sin tener casos de rabia humana y pueden estar muy cerca de alcanzar la meta de eliminación. PIAN es otra de las enfermedades que creemos que está interrumpida en la región, o la defecación al aire libre, en la que los países han invertido tanto para incrementar acceso a agua y saneamiento. Sin embargo, tenemos otro grupo de enfermedades en el cual hay un gran número de países que necesita acelerar los esfuerzos para eliminarlas. Las meningitis bacterianas son una de ellas. Algunos países todavía necesitan avanzar en la eliminación de malaria, como lo han hecho Surinam y otros 19 países en la región de las Américas. Tenemos enfermedades transmisibles tropicales desatendidas en las cuales también es necesario acelerar. Filariasis linfática, lepra. Más de 20 países todavía reportan casos de lepra, una enfermedad para la que tenemos tratamiento. Y al final de esta lámina ustedes ven un alto número de países en donde todavía necesitamos acelerar la eliminación de enfermedades como el cáncer cervicuterino, tuberculosis, hepatitis virales, principalmente B y C, que son enfermedades en las cuales hoy tenemos herramientas, HIV, infecciones de transmisión sexual, como la gonorrea y la sífilis, o las mismas hepatitis B que la mencionamos en la transmisión madre a hijo. Esta es la razón, lo que ustedes ven aquí en esta lámina, por lo cual estamos convencidos de que si los países donantes y socios invierten en las mejores costo-efectivas intervenciones que hoy tenemos con demostrada evidencia funcionan, podemos cambiar ese panorama mucho más rápidamente, con más fuerza a nivel local, y por eso lanzamos estos que son los Best Buy, que ustedes están viendo un ejemplo en la pantalla, están viendo el ejemplo del de lepra. Son herramientas concretas que nos permiten saber qué hacer, en dónde invertir los recursos que tenemos y cómo hacer un mejor uso de los pocos fondos que a veces hay. Y para explicar un poco, aquí les muestro el de tuberculosis. En este ejemplo tenemos cuál es la meta. Es muy difícil que cualquiera de nosotros aquí se sepa la meta de eliminación de 34 enfermedades. ¿Cuál es la meta? ¿Qué debemos lograr antes de la eliminación para acercarnos? Y sobre todo, en la parte central, ¿cuál es el paquete de intervenciones clave en que se debe invertir para alcanzarlo? Si logramos implementar estas mejores inversiones, nosotros sabemos que es posible acelerar las metas de eliminación, así que por lo tanto los invitamos a consultarlos, a usarlos, y la cooperación técnica de la organización está a su disposición para que esas mejores inversiones se puedan implementar en sus países. Este es el código QR a la página web en la cual encuentran los 34 Best Buys o mejores inversiones. Están disponibles en los 4 idiomas. Y sin más preámbulo, ahora veamos cómo los países están implementando estas mejores inversiones en la región de las Américas. Antes de eso vamos a mostrar un video que nos muestra cómo están en Brasil, por ejemplo, implementando acciones en enfermedad avanzada de HIV. HIV es una de las enfermedades con meta de eliminación como problema de salud pública en la región. Así que aquí está el video.
Tuberculose, criptococose e histoplasmose são as 3 principais infecções oportunistas que mais matam pessoas com AIDS hoje em dia.
É preciso que essa abordagem ela seja integral. Apenas a disponibilização de testes rápidos, point of care, e mesmo somente o tratamento, ele não é capaz de resolver a situação de vulnerabilidade que essa população ela se encontra. Está muito associado com estigma, o preconceito, a fome, a miséria e a falta de acesso a serviços de saúde, levando a um desfecho desigual entre as populações.
E a gente ter um método diagnóstico rápido para ter certeza do que a gente está tratando faz muita diferença.
A diferença dos testes rápidos para os métodos convencionais é que em 30 a 40 minutos nós conseguimos saber qual é a infecção oportunista que está acometendo essa pessoa. Nós somos um grupo que se sensibiliza muito com as questões de HIV e AIDS, então eu chego até a me emocionar para falar deles, mas que de fato é uma equipe que faz muita diferença assim, no trabalho aqui em Porto Alegre e que tem muita vontade de mudar as condições materiais de vida das pessoas.
A continuación daremos inicio al panel de las experiencias nacionales en las que conoceremos cómo los países de nuestra región están implementando estas mejores inversiones a nivel local. Este panel será moderado por la doctora Mónica Alonso, jefa de la Unidad de VIH, Hepatitis, Tuberculosis e Infecciones de Transmisión Sexual de la Organización Panamericana de la Salud. Junto con ella nos acompañarán el honorable doctor Frank Anthony, ministro de Salud de Guyana, la honorable doctora María Teresa Barán, ministra de Salud de Paraguay, el doctor Stephen Vreden, asesor del Ministerio de Salud de Surinam, para compartir con nosotros sus experiencias. Por favor, los invitamos a pasar enfrente. Doctora Mónica, quedamos en sus manos.
Muchas gracias. ¿Se oye? Muchas gracias, Marta. Good afternoon, honorable ministers, delegations, director, assistant director, deputy director, colleagues, and friends. It is a pleasure to moderate this panel in which we're going to listen to distinguished leaders of countries in our region explain to us how they have implemented the best buys in areas of viral hepatitis C, in areas of HIV, TB, STIs, and viral hepatitis in context of prisons, and also how they have implemented the efforts for malaria elimination. So, without further ado, I remind you we will have 2 questions per each panelist. We request that you be succinct and limit the responses to 3 minutes for each question. We will start with a first round, and then we will continue with the second round of questions. So first, Dr. Frank Anthony, let me start with you. What have been the most impactful interventions in Guyana for the elimination of hepatitis C? And what were the most successful factors that made that progress possible?
So thank you very much for your question. Hep C has been a problem in Guyana. We detected that because through our blood transfusion process, we've been able to identify persons who come to donate blood, and we were able to detect that some of them had Hep C. But we were not able to do anything about it because we didn't have access to medication. And we tried to work with some of the pharmaceutical companies, but at the time, the cost of medication, the cost of treatment for a patient would have been close to $2,000 per patient. So in 2022, I think when I came here, one of the things that I saw was that through the strategic fund that countries were able to access Hep C medication. So that was one of my takeaways when I came to the Directing Council meeting, and I decided that we want to implement this in Guyana. So because we now have access to medication, we went back, we were able to set up our program, And through that program, we were able to access both the testing and medication through the PAHO Strategic Fund. And just for context, when we were trying to do it with the pharmaceutical companies, we were going to get $2,000 per patient. And through the strategic fund, we were able to access it at less than $100 per patient. So I think that's really a best buy. And that's why, for us, we thought it was a no-brainer. We came through the strategic fund. And we have been implementing this since 2022. We have 192 patients, and the cure rate is about 92 to 95%. So we are quite happy with this intervention.
Thank you, Dr. Anthony. Definitely a best buy at those prices, and also with the success rate that you're mentioning for viral hepatitis C, which previously was an illness that we didn't have cure for, and of course that causes not only cirrhosis, but also cancer of the liver. Ahora vamos a pasar a Paraguay. Doctora Barán, ¿qué elementos fueron claves para implementar ese paquete de servicios integrales como VIH, tuberculosis, ITS, hepatitis virales en esos contextos penitenciarios en el Paraguay?
Bueno, señora Mónica, muchas gracias. Es un honor para mí participar de esta sesión dedicada a acelerar la eliminación de enfermedades mediante el alcance a poblaciones en situación de vulnerabilidad. En Paraguay enfrentamos un desafío particular en nuestros centros penitenciarios. Contamos con 20 establecimientos que albergan alrededor de 19.000 personas privadas de libertad. Allí se concentra aproximadamente el 20% de la carga nacional de tuberculosis. O sea que unos 900 de los 4.500 casos que reportamos cada año. Nuestros estudios genómicos demostraron que cerca del 30% de los casos de tuberculosis en la comunidad están directamente vinculadas a las prisiones. Esto significa que el 50% de la epidemia de tuberculosis en el país se relaciona con las prisiones. Por esta razón, pusimos un énfasis estratégico en el control de la tuberculosis en estos lugares, entendiendo que las prisiones son el motor de la epidemia en Paraguay. Controlar la tuberculosis en las prisiones no es tarea exclusiva del Programa Nacional de Tuberculosis. El incremento de casos no solo constituye un desafío de salud, sino que también refleja condiciones de vulnerabilidad social y estructural que demandan intervenciones intersectoriales sobre sus determinantes. Actualmente, el Programa Nacional de Tuberculosis, en coordinación con la Dirección de Salud Penitenciaria del Ministerio de Justicia, trabaja de manera articulada con el Programa Nacional del Control de SIDA, que integra servicios de VIH, ITS, hepatitis, principalmente mediante tamizaje sistemático al ingreso y durante la permanencia en el penal. A ello se suma el trabajo del programa ampliado de inmunizaciones, que garantiza una vacunación sistemática contra la hepatitis B, tétano, difteria, influenza y COVID, junto con tamizajes de diabetes y salud mental de acuerdo con el perfil de riesgo que cada persona privada de libertad. Hoy contamos con 2 prisiones nuevas, Mingaguazú y Emboscada, y ahí estamos aplicando un modelo que incluye tamizaje universal a todos los nuevos ingresos, diagnóstico de tuberculosis latente mediante IGRA y terapia preventiva de la infección latente. El modelo busca que estos centros penitenciarios se conviertan en espacios con valores cercanos a la eliminación de la tuberculosis. Otro componente clave ha sido la incorporación de promotores de la salud dentro de los penales, personas privadas de libertad capacitados y comprometidos con el cuidado de la salud en sus sectores, así como el entrenamiento y cuidado del personal penitenciario de la salud, fortaleciendo la capacidad de respuesta dentro del sistema. Desde el Ministerio de Salud estamos convencidos de que manteniendo una prisión sana significa también proteger la salud de la población general. Muchas gracias.
Muchas gracias. Muchas gracias, doctora Barán. Realmente ha estado clarísimo los datos que nos ha dado que demuestran que atender la salud en las prisiones es una atención orientada hacia la salud pública de toda la comunidad. Ahí pasaremos también ahora al doctor Stefan Vreden. What lessons can other countries learn from Suriname's experience in training and equipping local community members, especially in those hard-to-reach areas, to lead malaria elimination efforts?
Thank you for that question. There are several lessons to learn because malaria management, malaria diagnosis and treatment needed to be available in two quite different settings. One is the stable communities in the interior. In those communities, we have an organization called Medical Mission that has been providing care to people living in the interior, indigenous people, maroon people. And this is an organization that has been there for 60 years. What we've been doing with regard to malaria is making sure that in every village, in every hamlet, there was malaria diagnosis and treatment available. Initially, that was before rapid tests were used. We had to do it with microscopy. But we saw that microscopy, it takes time, and it also takes quite a lot of people who are experienced in doing microscopy. So in the year 2003 already, we started testing rapid tests to see what their quality was. And as soon as there was a rapid test of an adequate quality, we implemented rapid tests because that made a big difference. We continued doing malaria microscopy because we knew that you need to confirm your diagnosis with microscopy, but for more than 90% of the people, malaria diagnosis could be done in 10 or 20 minutes. So that is one of the most important things that we did in the stable communities. In the mobile and migrant populations, which are, as the Minister said, mostly related to small-scale gold mining, this was completely different. Because those mining situations are not very safe. So you could not deploy your staff there, especially since we think that malaria diagnosis should be available 7 times 24 hours. So we started recruiting people from the community who were there on their own risk because they were working in the gold mining community. And we trained them in doing malaria diagnosis and also in doing giving the treatment. And these were people who were sometimes shopkeepers, sometimes cooks, but people who were available and who had a certain level of intelligence, so you could easily train them. So that worked well. And gradually, we could even involve these people in surveillance, because you can do a diagnosis, but you need to know also how much malaria there is. And I must say with mobile phones, it's easy to have real-time communication with these people. And I think that was something that really changed the pattern of malaria in the mining fields. As a small example, I can tell you that in the year 2023, because we have no local transmission of malaria, but there are still quite some imported cases. In the year 2023, more than 30% of the malaria cases diagnosed in Suriname were diagnosed by these people in the mining fields. And if these cases had not been diagnosed immediately, we would have never reached malaria elimination. So I think this says enough about the effect of involving the communities in helping you get rid of diseases. Thank you.
Thank you very much. Impressive. Very impressive. This is definitely public health in action, and definitely we see the best buys and how they're implemented, right? Because it's not only having the rapid tests, but how you involve the community in order to amplify its effects. So thank you, Dr. Freden. Now we will continue back to Guyana. Back to viral hepatitis C elimination. And of course, in the implementation with that very successful treatment, what are the challenges that Guyana is facing in expanding hepatitis C services, and how are you addressing these challenges?
So we have several challenges. I think Guyana is a fairly large country. We have 10 regions. And this program, we started it in Georgetown, which is where we have the capital. We have now been able to roll it out to about 5 regions. And so we need to go to the other 5 regions to make sure that people can access these types of treatment. Because of that, too, we've seen a variance of prevalence. So in the regions where we're doing more testing, obviously we're seeing cases. So that's something that we hope by taking it out to the other regions, we'll probably see an increase in cases out there, because so far they have been underserved. So that's one of the things that we're doing. The other thing that I think we need to strengthen is to, while we have developed guidelines, is to make sure that all our physicians, especially those in primary care, would be able to do this on their own. We have about 450 primary care units in different locations. So if we train primary care physicians and the physician assistants, we think that we'll be able to rapidly expand this. So that's something that we're working on. We have finished the guidelines. Now it's rolling out the guidelines and making that implementable across the system. We also have to tighten our accessing meds and distributing it. We do have some challenges with that, so we're strengthening on that front as well. One of the things that we're implementing is to put in an electronic system for monitoring medication. And so by the end of this year, early next year, first quarter of next year, that system should be up and running so that we will be able to trace, as we buy things and bring them into the central material management unit, until it goes out to the patient, we'll be able to monitor that. So that would complement what we're doing. We're also implementing electronic health records, so we'll be able to see and follow up with patients. And despite wherever they go in the system, we'll be able to identify them and work with them. So I think we still have some challenges, although we see this program as a very positive program. Being able to offer treatment that wasn't there before, we now need to make sure that it's rolled out across Guyana, and that's what we are endeavoring to do now. Thank you.
Thank you. Thank you very much. Yes, many times we encounter that patients with viral hepatitis are mostly hidden, so there has to be a lot of testing to find those patients, and of course the awareness and the capacity building of those health providers to actually test and be aware. So, and that coupled with the electronic medical records and information systems, I'm sure that's going to make the program very, very successful. Doctora María Teresa Barán, ¿cómo han contribuido el uso de tecnologías e innovaciones, como por ejemplo la radiografía portátil con inteligencia artificial, a reducir brechas en el diagnóstico y tratamiento de enfermedades infecciosas como TB, pero también otras innovaciones para VIH, ITS, hepatitis? Nos ha hablado de algunas anteriormente con respecto a las vacunas. ¿Qué más? ¿Qué más nos puede contar?
Sí. Para Paraguay ha sido pionero en la región en la introducción de la radiografía digital asistida con inteligencia artificial como una herramienta de tamizaje de tuberculosis en prisiones. La principal ventaja es que no requiere de la presencia de un radiólogo especializado para interpretar las imágenes. Esto ha permitido realizar tamizajes masivos y con mayor agilidad en un entorno donde los recursos humanos son limitados. Desde su implementación hemos logrado incrementar en forma importante la detección temprana de casos, incluso en personas con síntomas mínimos. Optimizar el uso de pruebas confirmatorias como el GeneXpert y la bacteriología, al dirigirlas hacia quienes la radiografía por inteligencia artificial señala como sospechosos. Reducir tiempos de diagnóstico, lo que se traduce en un inicio más rápido del tratamiento. Esto implica cortar la cadena de transmisión y proteger a toda la comunidad penitenciaria a través de un diagnóstico temprano. Esperemos que tras el aumento inicial en la detección gracias a la inteligencia artificial, logremos en los próximos meses una reducción sostenida de la tuberculosis en las prisiones. Esta experiencia confirma que la innovación tecnológica en poblaciones vulnerables es costo efectiva y estratégica para avanzar hacia la eliminación de enfermedades. Muchas gracias.
Muchas gracias. Sí, claramente más de la mitad. Muchas enhorabuenas. Más de la mitad de los casos que están siendo detectados por radiografía con inteligencia artificial no tienen síntomas y signos, por lo tanto es una herramienta muy eficaz y costo efectiva, a pesar de la inversión inicial que se tiene que hacer, pero realmente a la larga permite optimizar esas pruebas también de GeneXpert, como usted comentó. So we're moving on to Suriname. And we would want to know, Dr. Vreden, what lessons can other countries learn from Suriname's experience in training and equipping local community members? I think in local community members, especially in hard-to-reach areas, to lead malaria elimination efforts.
Yes. I think that one of the things that we need to realize is that there is a lot of illegality going on in mining. Law enforcement and health don't go together. So you really must focus on health without looking at whether someone is legal, illegal, criminal, or whatever. Otherwise, you will lose one of those battles. If you want to win the battle of health, don't get involved with the battle of law enforcement. That is one of the, because if we, especially when we came into the phase of pre-elimination, it's very important to have a very detailed case investigation. You need a travel history, and the people must trust you to tell you their travel history. So it is the people involved must be sure that you're a health worker and not a law enforcement person. That is something that we learned, and there is enough trust now in the mining field. So this is something that people need to realize. And also, we were training people recruited from the mining community. And you want to keep these people working for you for quite a long time, and they get a stipend, but that is not interesting because you cannot compete with payments in gold mining because these are enormous. What we do is every time when we train these people, we provide them with a certificate of malaria management. And I was surprised to see how these people value this certificate, because for most of them, it's the first certificate, the only certificate they ever had in their lives. So it makes them proud, it makes them feel that they really can mean something to their community. And this goes as far as that now we hardly have any malaria, but you want to keep these people motivated. So we also train them in doing blood pressure measurements, because that's also an epidemic in the gold mines, in diabetes management, in HIV testing, in viral hepatitis. So you can gradually expand their work to keep them motivated to do malaria, but also do other things that are very relevant to the community. So I think that these people, although they started as malaria service deliverers, you can also use them in providing more healthcare to the community that they're part of. I think that's about it.
That's fantastic. I was actually not expecting to hear also this lesson learned in integration. So I don't know if my microphone is on. I think it can be heard, because this is also a wonderful lesson for integration of several diseases in one response. Thank you very much for that. Well, I think we are on time for some questions and answers. I don't know. I'm looking to find there Marta Saboya, that was going to help manage the question and answer session.
Monica. Thank you, Monica, and panelists. Please stay there. So we have now some minutes to take comments or questions for our esteemed panelists, if any. Ambassador Céline, please.
Merci beaucoup. Je peux parler en français, n'est-ce pas? Merci beaucoup, Monsieur le Directeur Général, Mesdames et Messieurs les ministres, Mesdames et Messieurs les ambassadeurs, chers collègues. Je voudrais tout d'abord féliciter le Suriname pour la certification obtenue. Bravo pour cette belle réussite qui va renforcer la santé pour toute la région, et y compris pour nous qui sommes vos voisins. Je voudrais aussi remercier les intervenants pour la qualité des interventions et l'intérêt de ce que nous avons pu écouter aujourd'hui. La France, durant le conseil directeur de l'OPS en 2019, avait voté la résolution visant à éliminer 30 maladies transmissibles d'ici 2030. Et donc ici, je voudrais réaffirmer en fait notre appui à cette initiative d'élimination et notre engagement à poursuivre notre participation à cette mission de la plus haute importance pour la santé de nos populations, y compris par l'intervention de nos agences régionales de santé dans nos départements de la Caraïbe, en Guadeloupe, en Martinique et en Guyane française. Je tiens aussi à souligner le rôle clé que jouent nos universités aux Antilles et en Guyane, ainsi que l'expertise scientifique du réseau des instituts Pasteur dans les Amériques. Aujourd'hui, alors que nous saluons l'élimination du paludisme au Suriname, j'aimerais rappeler et insister sur l'importance de renforcer la coopération régionale pour accélérer l'élimination du paludisme dans les pays du plateau des Guyanes, donc l'État de l'Amapa au Brésil, le Suriname, le Guyana et bien sûr la Guyane française. L'élimination du paludisme revêt une importance clé pour assurer le développement humain et social de nos pays qui partagent les mêmes écosystèmes forestiers, les mêmes défis d'accès aux services de santé pour les populations dispersées de l'intérieur et surtout le grand défi des mouvements transfrontaliers des populations d'orpailleurs. La France est engagée à éliminer le paludisme en Guyane française d'ici 2030. Notre agence régionale de santé participe de manière active aux travaux du groupe de coordination du plateau des Guyanes et l'Institut Pasteur de Cayenne, qui est un centre collaborateur de l'OPS pour le paludisme, continuera à mettre son expertise scientifique à la disposition des pays du bassin amazonien. Merci beaucoup.
Très bonne nouvelle. Bon, we're going to take a few other questions. We're actually, I've heard very well with the time. So I think there's a question over there or comment.
Thank you very much, Philip Telesford Grenada. I welcome Suriname to malaria-free status. I think it's a wonderful achievement, and I commend you and your government for the hard work that and the tactical approach that you have adopted to acquire that status. I recognize that you have an open border country, and that would, of course, render you very vulnerable as far as malaria is concerned, and the fact that you mentioned migration, people migrating to a country for the purposes of mining. And that in itself will be a challenge. You also mentioned that health and law enforcement does not go hand in hand in the context that you must maintain a level of confidentiality with your patients. But my question to you is, how do you preserve that against the obligation to report and to ensure the security from a national security perspective as a government? How do you embrace national security, ensure that because malaria, gold mining is one aspect, only one aspect of business. There could be other criminal activities that could become a real threat to national security. In your fight against malaria and other diseases, how do you preserve the confidentiality of your patients in that context against another threat, the threat of criminal activities happening within your borders? Thank you.
Ok, gracias. Vamos a tomar un par de comentarios más y preguntas. Now I'm welcome Greg Nolan from the Carter Center to take the floor.
Thank you, Madam Chair. Honorable ministers, distinguished guests, delegates. My name is Greg Noland. I'm the director of the malaria, onchocerciasis, lymphatic filariasis, and schistosomiasis programs at the Carter Center. So I first bring you greetings on behalf of the leadership of the Carter Center on today, October 1st, would be President Carter's 101st birthday. The Carter Center, well, first, congratulations to Suriname. You have shown us what is possible. You have also shown us what is needed in the fight against malaria to focus on communities, particularly affected communities, with community-based approaches. So thank you and congratulations. The Carter Center is a WHO non-state actor, and so I have been invited to provide just very brief comments from the non-state actor perspective on efforts to eliminate among vulnerable populations. NTDs frequently affect the most neglected and vulnerable populations, as we all know, and I appreciate the opportunity to highlight a few best buys. We all know that elimination is always a best buy because it allows program resources to be reallocated for other initiatives once success is achieved. Since 1996, the Carter Center has worked with PAHO and National Ministries of Health to eliminate onchocerciasis from the Americas region. This effort was first guided by the 1991 CD35R14 resolution, calling for elimination of blinding morbidity associated with onchocerciasis, and the later 2008 CD48R12 resolution. Since that time, 4 countries, Colombia, Ecuador, Mexico, Guatemala, have achieved WHO verification of transmission elimination of onchocerciasis, resulting in a 93% reduction in the at-risk population in the region. However, a small population of around 40,000 people remain at risk. That is the Yanomami people and other indigenous peoples deep in the Amazon jungle along the cross-border region between Brazil and Venezuela. This population is also threatened by illegal mining, as has already been mentioned, by deforestation and other encroachments that bring violence and disease from the outside world. In partnership with PAHO, the Carter Center supports Ministries of Health teams by boat, helicopter, and fixed-wing aircraft to provide interventions to interrupt onchocerciasis. But traveling all that way to only deliver one intervention would be a big missed opportunity. And so we just heard the importance of integration. And so we need to think beyond our siloed thinking And the program now embraces a more than Mectizan approach to also deliver immunizations, rapid testing, and treatment for malaria amongst the Yanomami populations. We are confident this integrated approach will help achieve the specific goal of eliminating onchocerciasis from the Yanomami focus area, thereby creating an entire Americas region free of this blinding disease. But vulnerable populations aren't limited only to remote jungle locations. On the island of Hispaniola, the urban residents of Port-au-Prince, Haiti, suffer indiscriminate violence, while those living in the countryside suffer from the atrophy of health services. Similarly, on the other side of the border, migrant farm workers in rural areas of the Dominican Republic also face challenges accessing health services. Each of these contexts presents a unique threat to public health, especially in efforts to eliminate neglected tropical diseases and malaria. In conclusion, it is often said there are no neglected diseases, only neglected people. So I applaud this session's focus on vulnerable populations. The Carter Center appreciates the longstanding partnership with PAHO to jointly support ministries of health in their efforts to create a healthier Americas region under the Elimination Initiative framework. Thank you very much.
I think we can pass to the responses. Dr. Vreden, would you like to take the mic to respond to Minister of Guyana, and then?
Oh, yes. Thank you for your question. My primary profession is I'm a specialist in internal medicine. And I have been working at the academic hospital in Paramaribo. And I have been consulted quite often with people who are in the legal system. They often came directly from prisons to see us in the hospital because for some ailments. One thing that one of my ancient teachers taught me, it's better not to know why someone is in your office, because it might influence your attitude towards this person. So I never asked, I didn't want to know. But doctors, yes, we are trained to just provide healthcare and not to do other things, to report people. It's even against the law to do that. And it's important because you're working with people who don't have a formal medical training, but it's important to explain this to them, that you're here working for the health system and every other thing is for another department. And especially if you are not focusing on what you need to do, you will not reach what you want to reach. So it's something about training and about consequently saying, we are here not for law enforcement, we're here for health provision. And it's doable, and people understand also because they see that you gain trust. If someone thinks that you're related to police or whatever, he will never tell you about his whereabouts. And that's what you need to know if you want to get rid of malaria. I hope this answers your question to some extent.
Thank you. We are going to now pass the floor to Dr. Anthony.
Thank you very much. First of all, let me thank France for the intervention. I know many years ago we did have very good relationship with Institut Pasteur, and we did a lot of good research work. So I look forward probably for us to resuscitate those links, because I think we have common problems that we can address together. In terms of the Carter Center, we have done work with you more on the area of democracy, and we haven't done so much work in health. But I think expanding to health would also be very useful, because I'm sure there are areas in which we can partner with you. One of the things that have been very successful for us is that we have been collaborating with the countries around us. We have very good collaboration with Brazil, and in fact, we do cross-border vaccination. Just earlier this year, I was on the neighboring town in Brazil that borders with Guyana. And we had very good response because our medical team would go across, their medical team would interact with us, and whatever the issues are across the border, we try to address them. We also had, I would say had, a commission between ourselves and Suriname, a health commission. And from time to time it works and then it goes dormant. So that's something perhaps that we need to pick up because we can discuss these matters that affect both countries and we can fix them. With Venezuela, we actually do see a lot of patients from Venezuela that come and access service in Guyana. And we provide that service just like we provide for any other Guyanese citizen. And in cases where they need to be medevaced, we medevac them to our central hospital and provide care for them. So that's something that we have been doing, and I think that has worked very well because we know in cases of infectious diseases, you can't vaccinate on one side and expect that the other side would be okay. So we have been doing that, and I think that has been really working for us. Our elimination agenda goes beyond Hep C, and we have been working on other diseases. For cervical cancer, we have partnered with PAHO, and that's another best buy that I think countries should buy into. PAHO has recently signed an agreement, I think, with Merck, and now you can access Gardasil 9 for about $15 US. Compare that to in the US, I think it's $360 US per dose. That's a good buy as well. We have recently switched, and we are now using Gardasil 9, which is more protective for HPV. We've also introduced HPV screening, so that's something that we've been working on. But HPV is on our agenda. We have been working along with PAHO for a number of years in terms of filaria elimination, and we are on target. We believe that before 2030, we'll be able to eliminate that as well. Malaria has also been on our agenda, and similar things to what Suriname did and continues to do, we have been doing that. Malaria is now endemic in 4 of our 10 administrative regions, and by continuing to push some of these programs, we are confident that before 2030, we'll actually be able to eliminate malaria. We have also been working on leishmaniasis, Chagas, and a number of other leprosy, TB, PMTCT. So there are lots of programs, and I think we have demonstrated good success. But as these programs mature, we'll be able to see those results. But we'll be making quite a lot of investments, and I can say that we have counted a lot on PAHO for the technical assistance, and in some cases where medication has been available, we try to get that and access that through the strategic fund. I would want to, as a country, we have benefited tremendously through this relationship. It puzzles me, though, that many other countries that have similar challenges are not utilizing, maybe they don't know the options that are available, but certainly not utilizing the opportunities that presents itself through the revolving fund and the strategic fund. So perhaps it's something that countries should think about, because I'm speaking from personal experience where we have benefited. And if we can benefit, I'm sure PAHO want to share this benefit with everyone. So don't be shy. Maybe you need to approach them and talk to them some more. Thank you.
Thank you. Thank you, Dr. Anthony. Would you like, o está bien? ¿Quiere decir algo? Estamos bien. Yes, before we close, there's several items I would want to highlight from our speakers, and maybe we could start with the strategic fund. As Dr. Anthony was mentioning, he mentioned several examples. We have a long list of not only medicines, but also diagnostics, but also equipment, as Dr. Baran was mentioning about the portable X-ray machines with artificial intelligence. That also is available through the Strategic Fund. So the Strategic Fund is fully aligned with the Elimination Initiative in support of the Elimination Initiative and offers not only these supplies and diagnostics and medicines at affordable prices, but alongside technical cooperation to collaborate with you in where to place them, how to implement, etc. Also, besides the clear cost effectiveness of these best buys that we're seeing, we saw the governance, right? The leadership that is first and foremost needed to actually move ahead to implement the best buys and accelerate the progress towards elimination, and that the work with the other community members, which is essential. In addition, I would want to thank the Carter Center for their support and their collaboration through these years in the elimination of onchocerciasis and also malaria. Very, very close partner to PAHO. And also the government of France for their commitment to support malaria elimination in the Guyanese Shield. So I just have to mention that really the Elimination Initiative is very ambitious, but that we have been doing it, we are doing it. We have multiple examples of malaria, EMTCT for HIV and congenital syphilis, lymphatic filariasis, onchocerciasis. So we just have to accelerate for all those other countries that Marta was showing that are still in red or orange, but we have the tools, these best buys, to accelerate in the elimination. So with all the member states, the partner countries, the other partners, the civil society as well, all of us together, we could achieve elimination by 2030. So thank you very much for attending. We will pass on to the next session, the next component.
Thank you. Thank you to our esteemed panelists. We invite all of you to take your seats. And with this great panel, it is my honor to invite Dr. Rhonda Seeley-Thomas, Assistant Director of PAHO, for the closing remarks.
Thank you, Marta. Distinguished delegates, esteemed colleagues and partners, I'd like to sincerely thank all of you for your participation and engagement as we conclude this important session. Today, we have heard powerful interventions from Guyana, Paraguay, and Suriname. Dr. Anthony, Dr. Baran, and Dr. Vreden, thank you for demonstrating that with commitment, innovation, and collaboration, disease elimination is not just possible, it's actually happening right now. We also had the privilege of listening to Robert Matiru, Director of Programs of Unit Aid, who reminded us of the significance of global partnerships in accelerating access to the tools and solutions that make disease elimination a reality. One of the most inspiring moments today was recognizing Suriname for achieving malaria elimination. This public health milestone, the first of its kind in the Amazon basin, is a testament to what can be achieved with solid determination, sustained investment, and community engagement. It also sends a strong signal of hope to other countries still facing this disease. The discussions today reaffirmed that the region of the Americas has effective best buys at hand that are evidence-based, cost-effective interventions that work. Our collective challenge now is to ensure that these solutions are scaled up, integrated into primary health care, and delivered to the populations that need them the most, especially those living in conditions of vulnerability. Let me emphasize that the Pan American Health Organization remains fully committed to supporting member states in this journey. Working together, hand in hand, we can accelerate progress, protect the gains we have achieved, and move closer to a future where no one in the Americas suffers from diseases that can and should be eliminated. Finally, I'd like to thank Dr. Aldejeri, Marta Alonso, and Monica Soboya and his team, the team from the CD department, for organizing and orchestrating this session. Thanks once again to all of you for your commitment and partnership. Thank you.
Thank you, Dr. Silly Thomas, and we wish you the best in the rest of the afternoon. Thank you very much.
Si no salgo antes de las 6, la lluvia nos atrapa. Aquí siempre nos adelantamos al amanecer, a la lancha que se va sin ti y también a la enfermedad. Antes, registrar las vacunas era inscribir en papeles que se mojaban o perdían. Ahora, con el aplicativo, todo cambió. Ya no me preocupo si hay internet, guardo todo aquí y cuando hay señal, sube solo. Las vacunas salvan vidas, por eso nos adelantamos, para que no vuelva lo que antes nos quitó tanto. Sabemos quién necesita qué vacuna, incluso aquí en la frontera. Ya nadie nos gana, nosotros le ganamos a las enfermedades. Ahora los datos llegan a Lima y nosotros llegamos primero.
Hola, buenas tardes.
Con la digitalización de los datos, mejoramos la calidad del proceso de vacunación y aseguramos tener información oportuna para tomar decisiones. La OPS y el Ministerio de Salud del Perú, con el apoyo de la cooperación alemana implementada por GIZ, estamos trabajando para cortar las distancias con tecnología, usando herramientas basadas en las Smart Guidelines de la OMS y fortaleciendo el personal que hace posible la vacunación. Nuestro compromiso es claro: seguir trabajando con el país y sus aliados para cerrar brechas tecnológicas y asegurar que todas las comunidades, sin importar dónde estén, accedan a servicios de salud esenciales. Continuamos en el camino para lograr la salud para todos.